as you can tell, this isn't Dr. Peter Glidden. This is Dr. Heather Rooks. Today I'm filling in for Dr. Peter Glidden, happy to be here with everybody. Want to give you a little bit of information about who I am and why Dr. Glidden's asked me to help him with his show. A couple weeks ago, I was on the show with Dr. Glidden, and he basically said that he thought he had doubled himself in a female chiropractor, and that's what I am and what I do for a living. A little bit about me. I am a doctor of chiropractic, and I started my career in 2002 practicing traditional chiropractic. And I don't like to use the terminology of chiropractic medicine because within the field of chiropractic we don't give medicine. What we do is look to the spine and the structure of the body for any imbalances or interference in the nerve system for health issues. Secondary to that, what I found in my practice originally was I had a lot of clients and patients that I was working for and with that were not recovering from serious health issues. So a little bit more about me is I graduated from chiropractic school. I went to Life University in Atlanta, Georgia in 2002 and immediately started practice as an associate doctor in a large practice in Brooklyn, New York, working in the Jewish and Hasidic populations. And by the end of that year, found myself essentially dealing with a health tragedy within my own family. That turned my interest back to my home state of Delaware, where I started my own individual chiropractic practice. At that time, what actually took place for me was I actually had to deal with the mean triad of heart disease, diabetes, and cancer all in my father, who was very young at the time, age 54 at that time. So as a doctor of chiropractic, I learned a holistic viewpoint, and here I was facing a major medical tragedy within my own family. So what actually transpired for me during that time was that I actually started to do a lot more research and reading and kicking in my nutrition education that I got in graduate school, and started to realize that to be a very effective practitioner, I was going to have to meld clinical nutrition and supplementation as well as chiropractic care for the overall health of everyone in my practice and in my family. One of the things that really struck me at that time was really how backwards and how upsetting it was to be involved in the actual medical system in the hospital dealing with a major health crisis such as cancer. What actually transpired for me in my life was a serious look at the medical system and what was going on and why it had failed most of the people in my family, but at that time in particular, my own father. So as I watched through my childhood, I actually knew that I wanted to help other people, but I got the confirmation at that point that it wasn't in that manner. In fact, I actually really got turned off of the way that the major medical paradigm works when I had to witness and undergo 2 years of terminal illness with my immediate family, that being my father. So to make a long story short, I turned my complete attention on how to help people prevent things from actually breaking down in their body and how to prevent these major health disasters, which is why synchronistically I found my way to longevity products and Dr. Wallach and essentially Dr. Peter Glidden. Dr. Peter Glidden's radio show and website, fireyourmdnow.com, gave me a lot of insight in the last few years with how to deal with some challenges and difficulties that I was seeing with my own clientele and actually be able to serve their needs better, their overall healthcare needs, not just those of spine and nervous system issues. That being said, I give a lot of credit and respect to Dr. Wallach for all of the research that he's done, and I applaud and thank him on a daily basis for him giving me the opportunity to be able to serve the public even better with his nutritional supplementation. If you are not aware of who Dr. Wallach or longevity is listening to this show, you must be new. So hold on, because we're going to cover a lot of information today in regards to the longevity products, the clinical nutritional protocols that Dr. Wallach has put together and that Dr. Glidden actually also promotes, and the same protocols that I have in the past few years learned and started promoting within my practice with my patient members. There is no better supplement line. There are no better clinical nutritional products. They dwarf anything that I've ever seen in the field of medical nutrition, and I just get astounding results with my patients and even my family now. I have to say thank you, Dr. Wallach, for everything that you've done for me and my family and my clients, and giving me the opportunity to serve people on a higher level. With that being said, I am new at this, so I'm going to appreciate all of your patience. We are taking phone calls today. What we're going to do in this segment is cover a little bit more about my background and how I approach health issues in my office and with my clients. And then in the next hour or so, we're going to open up the phone lines to take some questions in particular to these topics. I find it really awesome that I've been able to find products that I think are just amazing and that work so well. It's actually made my job really easy. And to be honest, it's taken my results in chiropractic through the roof, to be honest. If there are any people who receive chiropractic care listening, which I hope there are, or if there are people who are contemplating receiving and getting chiropractic care, we'll go through why that is so important, as well as what you're doing if you are taking the longevity medical nutritional products. I work from a standard and a model in my office that I was taught but that I've added to, and within my office the model of healthcare that I deliver on a daily basis includes 5 factors of health. And the first and most important part of that is the clearly functioning nervous system. If you see a chiropractor, you probably heard them talk about the importance of the fact that your brain and body need to be in total communication all the time in order for your brain, which is the hard drive of your body, to run all the organs and parts of your body. So a clearly functioning nervous system is the first factor of health that I teach in my office. That is achieved through regular chiropractic care and chiropractic adjustments. If you're not sure what a chiropractor does, I'm going to explain that to you now. My job as a chiropractor is to locate and detect where in a person's body they might have nerve interference that is occurring as a result of spinal misalignments. Spinal misalignments can happen and occur in the body from things as simple as the birth process, learning how to walk, child falling, childhood traumas, falling off their bike. We get a little bit older, we start playing more active sports, possibly sleeping patterns, computer work. Stress for a lot of adults contributes to their poor structural alignment of their body. So when those things happen, you can have actual spinal misalignments that are created. And when those misalignments actually occur, they're important to correct, not just because of the structure of the body, but also because of the function of the spinal nerve tissue that is traversing or passing between spinal bones. I can't stress that to you enough. If you are taking medical nutrition, or if you're not, having a clearly functioning nervous system is the key for your brain being able to actually make proper nerve impulses so that your body can properly build up and break down cell tissue. That is the most important aspect to healing. The most important aspect to healing, again, is having a clear communication between the brain and body parts. The second point of my model in my office is the fact that you need proper nutrition. And proper nutrition today does include medical supplementation, clinically verified medical grade supplementation to your diet. If you are relying on your food for your nutrients, you are not going to be able to heal or be well, period. Period. That single statement is probably killed more people in this country, as Dr. Wallach says, and I agree. I concur. So if you don't have proper nutrition as far as maintaining proper supplementation, you will not be able to repair your body. And in order to heal, you must repair. The most important way that we do that in our office now is with the Longevity Healthy Start Pack. The Healthy Start Pack includes 3 products that Longevity has created that allow people on a daily basis to receive their 90 essential nutrients. That's the 90 for life, folks. That's the 90 for life message from Longevity. In order for your body to be supported and to promote the healthy structure and function and heal, you need to have the 90 essential nutrients every day go into your body. You're not going to get that just with your food. So with my second factor of health that I educate my clients on in my office with nutrition, it's got to include the supplementation package. If it does not, I can tell you the first 7 years of my career, you will not see a change in your body. Whether you're doing chiropractic, whether you're doing acupuncture, whether you're doing massage therapy, or you're just an avid exerciser and you keep your body quote unquote healthy with exercise, if you do not supplement your body, you are on the road to disaster down the road. I'm telling you right now. So that second factor in the model of care is nutrition and supplementation, and in my office, my go-to products are the Longevity Healthy Start Pack. Within that same model, we then move right into clean water. You've got to purify and find purified water. I do not recommend to my clients, to my patients, drinking tap water. If they do so, they are increasing the chemical exposures in their body to things like fluoride and things that tend to be very damaging for our glandular system and our nervous system. So I do advocate the use of purified water. We're going to cover the rest of the factors of health after we return from the break. I thank you for listening and hope that you stay tuned in. Welcome back to Fire MD Now. This is Dr. Heather Rooks filling in for Dr. Peter Glidden. Before the break, we were covering the 5 factors of health that I use to educate my clients and patients, and I want to continue that. We started out by saying number 1 was a clearly functioning nervous system, which I help people to achieve through regular chiropractic care. The second factor of health is nutrition and supplementation, which clearly I'm a big advocate for the Longevity nutraceutical products, and we use the Healthy Start Pack in our office for most people. The third factor of health we were talking about was clean water. As a human on the planet Earth, you have to find and purify water. I don't recommend that you drink tap water. Most of the tap water in our area, I'm in the northeast of the country, is ridden with fluoride and other pharmaceutical products that you have no idea. So purify water, guys. Now, the fourth aspect is exercise, and exercise is important both for movement and oxygenation of the body, and that is probably one of the most overlooked things that I see in clients. They don't realize. They think exercise is just to burn calories, but no. Exercise, being a factor of health, has to do with the old phrase, you either use it or you lose it. So if you don't move your body, your joints become stiff and achy. If you don't move your body, you lose muscle tone. The tendons and actually ligaments start to shorten and get dry in appearance and texture. If you don't move your body, your metabolism slows down. So yes, it's very easy for your body to accumulate and pack on extra pounds. If you don't move your body, your metabolism slows down. So it's easy for your fat metabolism to increase as your body starts storing what you're eating and consuming as fat rather than burning it like the metabolic machine that it was intended to be. So exercise is very important. And when I say movement, all kinds of exercise, I advocate aerobic, anaerobic. When I say anaerobic, that means in the lack of oxygen environment. So those types of activities would be like lifting weights or really heavy workouts where you can barely catch your breath. And that's equally as important as aerobic exercise, which we all know what that is. Cycling, treadmill, walking, running, elliptical training, swimming, those are all aerobic exercises. And then we move into our flexibility. Flexibility is very important. As you get a bit older and your body starts to become a bit more rigid or starts to feel that way, flexibility work is equally as important as cardio or aerobic and anaerobic or weightlifting. So I highly recommend exercise of all kinds to my clients. Now, the oxygenation component of exercise can be taken a step further, and that leads us right into the last category, or the fifth factor of health that I use in my model of care, and that is rest and relaxation. You must rest your body in order for it to repair. Your body cannot repair and heal if it is going to be constantly trying to be building up again. It can't build up and break down at the same time. So if you're the type of person who's go, go, go and always in a stressful environment, and you don't get ample sleep and you don't have downtime to rest and relax your body, over time that will have a negative impact on your health. I did that to myself in my early 20s. I don't recommend it. The rest and relaxation component of the fifth factor of health, as far as what I teach with my clients, it has a lot to do also with relaxation. Relaxation does not mean you have to be sleeping. That means doing activities that you enjoy. That could be reading. That could be meditating. That could be fishing. Those things are relaxing for most people. So the 5 factors of health, to overview: number 1, a clearly functioning nervous system. If you have questions about chiropractic or the types of chiropractic care that I would recommend, please call the show. And we're going to be taking callers here soon. The number to call in is 866-582-9933. So to call in to ask me questions, it would be 866-582-9933. Now, number 2, nutrition and supplementation. If you have questions in regards to certain health conditions that you or anyone in your family may have a question about, please also call in and ask some questions. 3rd factor of health, clean water. Purify it. Find it and purify it. 4th, exercise, movement and oxygen. And 5th is rest and relaxation. So those 5 factors of health give me a springboard for me to educate my clients and my patients about how to retrieve their health and how to regain it. But I must tell you, it wasn't until I added the clinically verified medical nutrition that longevity has to offer that I started seeing serious, permanent healing and changes in my clients. Before that, what I was seeing was a lot of the clients that were coming into me and patients that I was seeing were having the same chronic, degenerative, progressive problem, and then coming in over and over again with the same problem, and I wasn't happy about that. I wasn't okay with that. So I constantly was looking for more. I needed more. I needed more information. I needed to be able to do more. My patients were constantly asking me for more help. Doc, what can I do to get off this high blood pressure medicine? What can I do to reverse this type 2 diabetes? What can I do to avoid colds and flus? And what did I recommend? I didn't have anything at that point. Now, 90 for life, baby. That's where it's at. We're going to go to a break, and when we come back, we're going to continue discussing. This is Dr. Heather Rooks filling in for Dr. Peter Glidden on Fire Your MD Now. So let's talk about the meat and potatoes of what most people want to hear. Most people want to understand more about how to be healthy, how to get their health back, and how to not be sick. Well, you found the right show, guys, because this is Dr. Glidden's dialed it in, Dr. Wallach. They have all of the formulations that you're going to need for yourself and your family, not just to recover your health, but also help those around you not get ensnared by the medical trap, which we have in this country. We have a full-on medical monopoly going on. I personally have witnessed it with family members, great-grandmothers, grandfathers, grandmother, and my own father personally. So I've watched surgery after surgery, medication after medication, test after test to the avail, the person leading a quality of life that was terrible and ending up dying young. So if you don't want that future for yourself or your family, you should seriously consider getting a subscription to Dr. Glidden's website, FireYourMDNow.com. For $20 a month, that subscription will allow you all the archived webinars so that you can learn all the formulations and protocols that have already been put together for you to know what to get for your family, to know what to do for them, to reverse major health issues that they've been living with and dealing with, and going one to another medical specialist, which is leading them right down the rabbit hole, which is the wrong path. Dr. Glidden's website has helped me immensely educate my clients. I'm only 2 years into using the longevity protocols, but have seen miraculous changes in people's health. I've seen miraculous recoveries with the body's internal and innate intelligence running its show with optimum nutrition and people following the 5 factors of health that I recommend. I can't stress that to you enough, how important this message is. We don't do this and we don't put the time into educating for nothing. This message could literally save your life. We have to do everything that we can to educate you as doctors to support and promote the structure and function of your body to heal itself. Stop putting so much emphasis on what the white coat MD is telling you. Stop putting all of your faith and trust into that pink and orange pill bottle. Stop doing that. It's not getting you anywhere. There's a very, very bright humanitarian in the past that once said, insanity is doing the same thing over and over again and expecting a different result. Yeah, that was Albert Einstein. He was kind of smart, huh? So take this information and put it to use for yourself. Don't take our word for it. Try the products. That's what I did just shy of 2 years ago. And because of that, I have the strongest and most healthy son. I have a 10-month-old son at home, and because of using the longevity products and nutrition formulations, my son's off the charts. I don't take him to a traditional pediatrician. Sorry, guys. I do his healthcare. But based on what I see and what I read with the growth charts, he's above all of them. Learning-wise, he's above all of them. He's 9 months. He just turned 10 months, and at 9.5 months started walking. Yeah, he's walking at 9.5 months. How is that possible? It's only possible through proper nutrition, supplementation, clearly functioning nervous system. We love these products in our family. I have been turning everybody that I know onto them since we started using them, and we couldn't be happier. Hey, I'd rather give my son that than the top brand children's vitamin, which contains aspartame, GMOs, and other chemicals. If you give your children Flintstone vitamins, that's what you're giving them. Sorry, look it up. There is a great article online on greenmedinfo.com. Just type in children's vitamins and aspartame and GMOs. Those are chemicals. Those are lethal chemicals that your children are ingesting on a daily basis. How can we as society grow and flourish if we're poisoning our children? How can we grow and flourish if the food that we eat is not promoting our body's ability to grow and repair? We're not. All we're doing is we're on a rat race. We're on a gerbil wheel, and that wheel is putting us in the same place, sicker and sicker and sicker as a society. If you don't believe me, look at your own life. Evaluate it. How about that of your mom, your dad, your brother, your sister, your cousins, your co-workers? Name one person that you know that is in great health. Name one person that you know that's in their 40s or 50s that isn't undergoing surgeries and treatments and procedures and taking one medication after the other. Name one retiree that you know that doesn't spend most of their social time going to doctor's visits. Name one. Think about it. Analyze your own life. Look in the mirror. Look inside yourself and see, am I doing the best for myself and for my children and for my family? And if you're not, change something. Be brilliant. Be a genius like Albert Einstein. Change what you're doing. Get enrolled. Get involved with Longevity's medical nutrition supplementation. I'm telling you, they will blow your mind. Some of the things that I've seen in the last 2 years in my practice have absolutely blown my mind. I had people coming to me with all kinds of chronic, progressive, degenerative conditions, things that they had no idea they were going to have such a shortened quality of life. Their life was going to come to an immediate standstill because they're following medical doctors and neurologists' opinions and orthopedists about do this surgery, have this procedure, do this treatment, and they're still not getting better. Meanwhile, they come to see me, clients come to see me, and I'm not just talking about people off the street. I'm talking about high-level executives, government officials, families of medical doctors, That's right. The families of the people running the major hospitals in my area are my clients. Why? Because they're sick and they're tired and they want to take a different route. So take a different route. At my office, we are stressing people achieving total health. The name of my practice is PATH, Integrative Health Center. PATH stands for People Achieving Total Health. And I'm located in Chadds Pennsylvania, in the northeast quadrant of the country. Down the street from me is one of the largest pharmaceutical companies in the world. But their executives come to see me. Their human resource people come to see me. They're not taking pharmaceuticals. They're not taking the products that they're developing and marketing. No, because they don't want to still be sick. They want to be well. They don't want to have to choke down one medicine after the other or participate in one procedure after another. Trust me, as a doctor of chiropractic, I think we've gone down in the history books as the most attacked profession within the medical community, being called quacks. And as Dr. G says, we're the one being called quacks, but yet the natural healthcare professions, the naturopaths, the homeopaths, the herbalists, the chiropractors, the acupuncturists, we are the people that are leading the underground grass movement of society towards other options and other modalities and other methods of regaining their health. So if you, in the soul, in your heart and soul, you look in the mirror and you ask yourself the question, are you doing everything that you can to promote and support your body and your family's body's ability to function? If the question that is being posed to you makes you upset, it's because you don't want to know the answer. If you're having an emotional reaction right now, it's because you don't want to answer the question honestly. Very few people want to actually take the bull by the horn, and make a change. But to do that is to recover your health, is to also recover your freedom to a certain ability. That amount of gumption that it takes for you to make the shift and to tell your doctor no, or to say, I don't want to do this anymore, and to seek out alternatives, that same passion and that same fire is going to be what turns your life around. And if you're able to do that, and if you do that for yourself and your family, you'll never look back and regret. You'll never look back and say, well, what if I did that? Or what if I could have done that? Or what if I should have done that? You don't want to be a coulda, shoulda, woulda. You want to do it. You want to embrace the message that we're bringing from the Longevity family. Dr. Glidden and Team Glidden, we are trying so hard to change people's paradigms, because you need to understand that not only are you doing this, but everyone in on your street and everyone in your neighborhood and everyone in your community is like sheep falling right into line. And we at Team Glidden and Dr. Glidden and FireMDnow.com and Longevity want to see you have your health freedom. We want to see you live your dreams. We want to see you be able to get up on a day-to-day basis and be happy and function and not be in pain and be living and dying by the orange prescription bottles. There is a different way. You just have to make a change in your life. So if you are listening now and you have a question in regards to anything I've discussed so far, we are taking phone calls, and the number to call in is going to be 582-9933. Again, FireMD Now, call in 866-582-9933. We're going to be taking some phone calls here in the next segment. So when I read an article that tells me that the top U.S. brand of children's vitamins contain aspartame, GMOs, and other hazardous chemicals, that actually alarms me greatly. How can the powers that be allowing these things into your vitamins? You need to ask yourself that question. Aspartame, a known brain chemical and excitotoxin proven to affect children's brain, cause hyperactivity, is carcinogenic, meaning causes cancer. Why would we be giving children vitamins that have this in it? You don't have to. You don't have to. You can get your supplementation and your medical nutrition from Longevity and avoid these dangers. Dr. Wallach and his research team has made sure that the purest and most organic source of plant-derived minerals are in your products. Those are the key. The minerals are the key for your children to grow up healthy and strong with strong functioning immune systems. To allow your child to take chemicals and aspartame and genetically modified organisms in their vitamins is like the biggest oxymoron I've ever read. It's absolutely ridiculous. You have to wake up. If you have Flintstone vitamins in your cabinet, throw them in the trash. Get rid of them. Flush them. They're poison. They're supposed to be vitamins for children, and they're poison. Get rid of those. One of the best things I ever did was introduce my 10-month-old son to the longevity products. At 10 months old, he takes a daily dose of either Tangy Tangerine, the Beyond Tangy Tangerine, appropriate for body weight, of course, or the Cherry Mints. And he loves it, and he is off the charts in every category as far as height and weight. Now, the reason that you are being fed the information that you're being fed is because our medical system is a complete monopoly. It is a for-profit industry. So every time you walk through your doctor's office, it's a dollar sign, not in his eyes necessarily, but yeah, in his eyes too. But the pharmaceutical industry and the medical doctors have this whole thing wrapped up. Get people sick, keep them in the medical industry, and make money on them. Do you know, this is a trivia question, do you know that the top Fortune 500 companies in this country, there's 500 companies in the Fortune 500, makes sense, right? The top 10 companies are worth more than all of the other 490 companies combined in those top 10 companies. That's right, they're all pharmaceutical industry. They're all pharmaceutical companies making money and profiting off your and your family and your neighbors and your community's demise. So if you are enrolled in that system and you're unhappy with that and you're not getting the results that you're expecting and you're going around and around not getting any results, then you know why. Because you're not taking Longevity's plant-derived minerals, Healthy Start Pack, and the clinically verified nutrition that we represent. These products will help you to recover your health. They will help you to support and promote the structure and function of your own body and give your body back its ability to heal itself. We're going to a hard break. We'll see you on the return. Hi, and welcome back to Dr. Heather Rooks, hosting for Dr. Peter Glidden, Fire Your MD Now. We've got a caller on the line. And we're going to go to the caller now, and this is Erica from New Jersey. Hello, Erica?
Oh, hello. Hi.
Hi.
I'm calling about a surfer's ear.
Okay, who has this condition?
That is me.
That's you.
I've been having some problems with TMJ, and they did an MRI, and it turns out that I have some type of pronounced semicircular type of thing, and I've been looking it up online, and I believe it's some type of exotosis.
Yeah, exostosis. Yep, go ahead.
Yeah, and it's really big, and I'm assuming that's just another word for bone growth. Bone spur.
Yep.
Okay, and also I also have another type of a bony protrusion coming from the right condyle as well.
The right condyle, occipital condyle on the back of your head?
No, the lateral. It's a lateral protrusion.
Okay. All right. So are you a surfer?
No, I'm not. That's what I find. I've always had trouble, though, whenever I was walking. If there was wind, my ear felt like it was going to blow up. And I never knew why. I guess I know why now.
Yeah, well, so on the MRI, what they saw was that within your ear canal there was some bone buildup, and that's exostosis. That's the medical Latin term for bone buildup. All right, and so what can happen is that can constrict the ear canal. Okay, and that can be problematic. Have you had any hearing loss or deficit at all?
No, I had a hearing test maybe a year and a half ago. Everything was fine. I mean, this is something new that was just found. The only thing I'm experiencing right now is whenever I swallow, I feel that there's like air or like liquid in there. It feels like it's clogged. And I went to ENT, and he says there was nothing in there.
Okay, so what can happen sometimes is that the actual canal can get these bony fragments, and that's basically, I mean, I hate to be so frank with you, but it's almost like you have arthritis in your inner ear, okay? But we're going to talk about how to remedy that, okay? How to actually work on, promoting your body's ability to take care of that, okay? Because even though we know the term arthritis to be it's a very common condition, it's not normal, okay? And it's certainly not normal in the ear. So let's talk a little bit about how this actually happens. With this quote-unquote surfer's ear, you get this buildup of the bone, and it can actually happen along the canal, and it can also happen to the actual bones that make up your inner ear, so it can affect hearing. What you may be feeling right now is the buildup of the bone has created like a passageway where air or water can get trapped behind it. Okay, so you want to be careful with that because that can create infection. If the ENT looked in there and said he didn't see anything, then what you might be experiencing is that the wind or the air can get past that built-up canal and can actually create that sensation on the inner ear and the semicircular canal of your ear, okay? Now, if you've been having TMJ issues, which is what you thought it was, is it because you had pain on that side, or do you actually have like clicking and popping of your jaw too?
Do have a clicking and popping.
Okay, so I'm going to be honest with you. More than likely what you have going on is a two-way street here. Seems as though you need some nutrition assistance so that you don't keep building up these bony growths. All right, so exostosis is just another word for a bone. It's kind of your bone is calcium's being laid down and it's building up bone. So if you have that going on and they saw that on an MRI, we have some nutritional support to help your body to break that down so that doesn't continue to happen, number one. But as a chiropractor, right, I'm always going to go to structure first, okay? If you're having TMJ issues plus you're having inner ear issues, it would be very surprising if you had a chiropractic evaluation done and it wasn't found that you actually have upper cervical or upper neck misalignments going on as well, okay? Because these two areas are both basically structurally in the same area, but they are innervated or get their nerve supply from the upper cervical, which is basically where your occiput, which is your head bone, sits on top of your neck. All right, there's 12 sets of nerves that exit at that point that go into your inner ear and into your jaw, the facial muscles, etc., etc. So it might behoove you to find a good chiropractor in your area to get an alignment and an assessment done of your upper neck particularly. Secondarily to that, for any kind of calcium or bone breakdown or buildup deficiency issue, we have within Longevity a supplement that I'm going to recommend a group of. Right now we're going to go to break, Erica, and when we get back, I'll give you that entire protocol, okay?